After obtaining informed consent from your patient and explaining the procedure thoroughly, you're going to apply the tourniquet to the patient's arm and locate the vein. Clean the skin with ChloraPrep for 30 seconds using a circular motion. Hold the needle between thumb and middle finger with index finger resting on the catheter. Insert the needle at a 15-degree angle and watch for the flashback in the chamber. Advance the needle 1 to 2 millimeters at a 10-degree angle, then advance the catheter carefully. Apply a firm tamponade 2 to 3 inches above the catheter and engage the safety to withdraw the needle. Screw on your pre-flushed IV extension kit. Remove the tourniquet and flush with 8 cc's of saline. Snap your stat lock onto the catheter and adhere IV to the arm. Place the tegaderm over the IV with the stat lock. You can also write the date of the IV and place the sticker on the tegaderm. Disconnect the syringe. So place your first strip of tape over the catheter directly. Take the second strip of tape over the extension and back over the catheter to secure the IV. At this point, you can check in with your patient and see if they're experiencing any pain or pressure or swelling. So can you tell me what are the indications for starting a peripheral IV?
So there's a few reasons to do this procedure, and it may come in handy at any time during your career as a PA. It is most often used for administration of IV medications as well as IV fluids, and usually needed for quick onset because it bypasses first-pass metabolism. Yeah.
Are there any contraindications for the procedure?
There's no absolute indications. If the patient you need to set an IV in has a localized infection, burns, or any compromised skin at the insertion site, you should avoid that area. If the limb you're trying to place an IV on has had a previous lymph node clearance, AV fistula formation, or DVT, then try another area as well. PICC line may be better utilized if needing to be left in for an extended course of time.
How about any complications that you see in this procedure?
With this being an invasive procedure, there are many chances for complications. To name a few, there could be damage to the artery or nerve that you're going for, hematoma or bleeding at the insertion site, infiltration of the IV into local tissue, phlebitis, occlusion of the catheter due to mechanical trauma, anaphylaxis in the patient, or allergic reactions to the meds or fluids. There could also be vasovagal syncope and thromboembolism as well. But we'll make sure that our patient stays coherent during our procedure. But you always need to be prepared for the worst case scenario.
Great. Is there any follow-up with the procedure?
Yeah, once the medication or fluid has been administered, then the follow-up care mentioned earlier can be attended to. Inform the patient about the importance of having a balanced meal after the IV and take in a good amount of hydration soon. Make sure to call if there are any concerns or present to the ER if there's an emergent bleeding episode following up. Patient education can also be given that a peripheral IV should not be in place with the same catheter for more than 48 to 72 hours.
Cool. Thanks for all your help today.
No problem.